Every week in my clinic, I sit across from men who are doing the right things, eating cleaner, walking more, cutting back on alcohol, and still watching their blood pressure inch upward, still noticing that their circulation feels slower, still experiencing the kind of vascular fatigue that shows up as cold extremities, sluggish recovery, and reduced sexual performance. And almost every single one of them has the same compound sitting in their kitchen cabinet that clinical research has shown to directly support blood vessel function, reduce vascular inflammation, and enhance nitric oxide availability in men over 60. They've never been told it works. Some of them have been told it doesn't. Today, I want to give you the clinical evidence, all of it, and let the research speak for itself. I'm Dr. Emily Carter, a board-certified urologist with over 12 years in clinical practice. I've spent a significant part of those 12 years watching men over 60 receive fragmented, incomplete, and sometimes flatly incorrect information about what actually drives vascular decline and what reverses it. Today, I want to give you what the clinical evidence actually says about sodium bicarbonate and blood flow. Not what a wellness blog says, not what a supplement company says, what the peer-reviewed research says, specifically with the mechanisms explained so clearly that you'll never have to take this on faith. Before we continue, drop a comment and tell me what you've heard about baking soda and circulation. I want to know what's circulating out there because this is a topic with genuine research on one side and significant noise on the other. If evidence-based content matters to you, hit that like button so other men can find this. Here is what most men over 60 have been told about sodium bicarbonate: that it's for baking, that it's an old heartburn remedy, that it's a folk remedy with no real science behind it. Here's what's wrong with all of that. Sodium bicarbonate is a compound with a well-characterized mechanism of action that has been studied in peer-reviewed journals, including the Journal of Immunology, the British Journal of Sports Medicine, and the American Heart Association's journal, Hypertension. The clinical reality is that sodium bicarbonate is not a folk remedy. It is a physiological buffer with direct, documented effects on vascular chemistry. And the reason most men haven't heard this from their physicians is not that the research is weak. It's that nutritional biochemistry receives a fraction of the clinical attention that pharmaceutical interventions do. That's a gap I take seriously. Let me close it. The foundational mechanism is this. As men age, and particularly as kidney efficiency declines after 60, the blood tends toward a subtly more acidic pH. This is not dramatic acidosis. It is a mild, chronic shift that operates below the threshold of symptoms most men would notice directly. But the effects are not subtle. In an acidic vascular environment, endothelial nitric oxide synthase, the enzyme responsible for producing nitric oxide in blood vessel walls, functions below capacity. Nitric oxide is the molecule that tells arterial smooth muscle to relax and dilate. When nitric oxide production is suppressed by acidic vascular chemistry, blood vessels maintain higher tone, arterial flexibility decreases, and peripheral blood flow, including blood flow to the penile tissue, to the heart muscle, to the extremities, is reduced. That is the mechanism. Sodium bicarbonate, taken at the correct dose and timing, directly corrects that shift. It buffers systemic acidity, restores a more alkaline vascular environment, and removes one of the primary chemical brakes on nitric oxide production. That is not a claim. That is documented biochemistry. A study from the Medical College of Georgia, published in the Journal of Immunology, examined what happens at a cellular level when the body receives an oral alkalizing signal. The researchers found that mesothelial cells lining the spleen, cells that function as environmental sensors for the immune system, respond to alkaline conditions by shifting immune output from pro-inflammatory to anti-inflammatory. Specifically, they observed a measurable reduction in tumor necrosis factor alpha and interleukin-17, two cytokines directly implicated in endothelial inflammation and arterial stiffening. Biologically, this is significant because chronic low-grade vascular inflammation is one of the primary drivers of endothelial dysfunction in aging men. It is the invisible process behind arteries that are stiffer than they should be, blood pressure that requires more force to maintain, and peripheral circulation that is slower than it was 10 years ago. Sodium bicarbonate in this research is not acting as a simple antacid. It is acting as an anti-inflammatory signal delivered through a pH sensing mechanism the body already possesses. That is a fundamentally different clinical picture than most men have been given. I remember Raymond, 66, a retired physician, not my patient in the traditional sense, but a colleague who came to me after noticing his own vascular markers deteriorating in ways he couldn't reconcile with his otherwise careful lifestyle. His blood pressure was averaging 141/88. His endothelial function test showed reduced flow-mediated dilation, a direct measure of how well his arterial walls could respond to increased blood flow demand. He was taking no medications. His lipid panel was excellent. His fasting glucose was normal. What his dietary history revealed was a pattern almost universal among high-achieving men of his generation. High protein, low vegetable, minimal alkalizing input, and a chronic mild dehydration he had normalized over decades. I introduced sodium bicarbonate at 1/4 teaspoon in water, taken 4 evenings per week, alongside a modest increase in vegetable intake. At 10 weeks, his average blood pressure had dropped to 126/79. His follow-up flow-mediated dilation test showed meaningful improvement. He told me, with the particular frustration of a physician who felt he should have known, "The mechanism was right in front of me." It usually is. That's exactly what today is for. Let me take you through the specific vascular pathways the research documents, because each one is distinct and each one matters for a different aspect of what men over 60 experience as circulatory decline. The first pathway is nitric oxide restoration. A study from the Journal of Applied Physiology examining pH manipulation and vascular endothelial response confirmed that alkaline vascular conditions measurably increase nitric oxide output from endothelial cells. The clinical significance for men over 60 is direct. Nitric oxide is the primary mediator of penile arterial dilation during erection, coronary arterial dilation during exertion, and peripheral arterial dilation during exercise and recovery. A man whose vascular chemistry is chronically acidic is operating with a suppressed nitric oxide system, and the downstream consequences touch every one of those functions simultaneously. The clinical evidence shows that correcting systemic pH with sodium bicarbonate restores a portion of that suppressed output. This is not the same mechanism as a phosphodiesterase 5 inhibitor, which prevents nitric oxide breakdown. This is upstream. This is supporting the production side of the equation. And for men who haven't addressed the production side, it is where the most correctable deficit sits. The second pathway is kidney pressure regulation. The kidneys govern blood pressure through the renin-angiotensin-aldosterone system, a hormonal cascade that controls how much fluid the vascular system retains and how much resistance the arterial walls maintain. A randomized controlled trial from the Royal London Hospital, 67 patients, 2 years of follow-up, found that sodium bicarbonate supplementation significantly slowed the rate of kidney filtration decline in patients with early chronic kidney disease compared to placebo. The mechanism is that kidneys operating in an acidic systemic environment must divert resources to acid excretion, which compromises their pressure regulatory efficiency. Restoring alkaline balance reduces that burden. For men over 60 whose blood pressure has been creeping upward despite lifestyle changes, this pathway is clinically relevant because the cause may not be dietary sodium, arterial stiffness, or stress alone. It may be a pH-driven reduction in the kidney's capacity to regulate pressure that has never been addressed. The third pathway is exercise performance and oxygen delivery, which connects directly to the cardiovascular health that determines long-term vascular function. A meta-analysis published in the British Journal of Sports Medicine reviewed 38 randomized controlled trials on sodium bicarbonate and exercise performance. The finding was consistent across studies. Bicarbonate supplementation produced statistically significant improvement in high-intensity performance, with the mechanism being hydrogen ion buffering during muscular effort. For men over 60, this is not about athletic performance as an end in itself. It is about the quality and intensity of the physical activity that stimulates endothelial adaptation, maintains muscle mass, and keeps the cardiovascular system under the kind of productive stress that preserves it. A man who can exercise harder, recover faster, and train more consistently is a man whose vascular system receives more of the stimulus it needs to remain functional. Sodium bicarbonate supports that capacity. Practically, for this effect specifically, the research-supported timing is 60 to 90 minutes before exercise at a dose of 0.2 grams per kilogram of body weight. For a 180-pound man, that is approximately 1/2 teaspoon dissolved in 8 ounces of water with a small meal. The fourth pathway is uric acid excretion and its relationship to arterial health. Most men know uric acid as the cause of gout. What most men don't know is that even at sub-gout levels, elevated uric acid is an independent risk factor for hypertension and endothelial damage. Research from the University of Chicago confirmed that uric acid directly impairs nitric oxide synthesis and measurably increases arterial stiffness, two effects that compound the vascular decline most men over 60 are already experiencing from other sources. Sodium bicarbonate alkalinizes urine, and uric acid is dramatically more soluble in alkaline urine than in acidic urine. This is basic renal chemistry, and it is the basis for sodium bicarbonate's long-standing clinical use in nephrology for uric acid management. For men eating a high-protein diet, which the majority of health-conscious men over 60 are, uric acid load is consistently elevated, and the vascular consequences of that elevation are consistently underaddressed. That's a myth. Here's the truth. Uric acid management is not just gout prevention, it is vascular protection. And sodium bicarbonate is one of the most direct tools available for it. I remember Martin, 73, a retired engineer who came to me after his primary care physician noticed persistently elevated uric acid on his annual labs and recommended he reduce red meat. Martin had reduced red meat. His uric acid had come down modestly, but remained at 7.2 milligrams per deciliter, above optimal. His blood pressure remained at 136/84. His chief complaint, which he offered quietly near the end of the appointment, was reduced morning erections and a noticeable decline in sexual performance over the previous 2 years. The connection between these three findings, elevated uric acid, borderline blood pressure, and reduced erectile function, is mechanistic, not coincidental. They are three expressions of the same underlying endothelial impairment. I introduced alkaline urine management with sodium bicarbonate, alongside increased hydration and continued dietary adjustment. At his 8-week review, his uric acid was 5.6. His average blood pressure had returned to 124/76. His morning erections had returned with a frequency and firmness he described as comparable to 5 years prior. He said, "I came in about my heart and left with something I didn't know I needed." That is what precision medicine looks like when the mechanism is correctly identified. Here is the complete protocol, built from what the peer-reviewed research supports. Begin with 1/4 teaspoon of pure sodium bicarbonate, standard baking soda, aluminum-free, no added ingredients, dissolved in 8 ounces of water. Take it on an empty stomach or with a very light fat source. Do this 3 times per week for the first 2 weeks. This is your tolerance assessment phase. Most men experience no side effects at this dose. Some experience mild, transient bloating in the first week as gut pH adjusts. This typically resolves on its own. After 2 weeks, if well tolerated, increase frequency to 4 to 5 times per week at the same dose. If you are physically active and using sodium bicarbonate to support exercise performance, you may increase the dose to 1/2 teaspoon for pre-exercise timing specifically, while maintaining 1/4 teaspoon for general systemic use on other days. Do not exceed 1 teaspoon per day without physician guidance. Time your dose with intention. For systemic blood flow support and overnight vascular recovery, the window during which endothelial repair processes are most active, evening timing, 60 minutes before sleep, is supported by the circadian biology of vascular repair. For exercise performance, the research-supported timing is 60 to 90 minutes before activity. If you are taking it for general anti-inflammatory and uric acid support, consistency of timing matters more than a specific clock hour. Choose a time you will reliably repeat. Pair sodium bicarbonate with adequate hydration. The buffering chemistry operates in a fluid environment. Men who are chronically underhydrated, and the majority of men over 60 are, will see reduced benefit and may experience mild digestive discomfort. 8 to 10 glasses of water per day is the clinical baseline for this protocol to function as the research documents it. One note of clinical precision. Men who are managing hypertension with sodium restriction should discuss dosing with their physician before beginning, as sodium bicarbonate does contain sodium. At the doses described, 1/4 to 1/2 teaspoon, the sodium contribution is modest, but it is not zero, and for men on strict restriction, it warrants a conversation. Men with normal or borderline blood pressure and no sodium restriction diagnosis can proceed at these doses without concern. Gentlemen, here's what I want you to take from this. The vascular decline that most men over 60 experience is not a single mechanism problem with a single mechanism solution. It is a convergence of pH shift, reduced nitric oxide bioavailability, elevated uric acid, declining kidney efficiency, and chronic low-grade inflammation, all operating simultaneously on the same endothelial system. Sodium bicarbonate does not correct all of that. Nothing does it alone. But it addresses the pH foundation that the other mechanisms depend on, and it does so at a cost of less than $2 a month, with a safety profile documented in peer-reviewed literature and a mechanism explained by basic biochemistry. That is a precision correction most men have never been offered. Now they have been. You haven't been failing. You've been working with incomplete information. The clinical evidence has been there. You just hadn't been shown it. Now you have the full picture. If this video corrected something you believed about sodium bicarbonate, about what drives blood flow decline, about what is actually available to you, tell me in the comments. Drop one thing this changed for you. Share this with a man in your life whose circulation concerns have been met with a prescription pad rather than a mechanism explanation. And subscribe, because next week I'm covering the amino acid that the vascular research consistently identifies as the most direct dietary precursor to nitric oxide production. And it pairs with everything we talked about today. I'm Dr. Emily Carter. The clinical evidence shows that sodium bicarbonate, taken consistently at the correct dose with precise timing, directly targets the pH-dependent suppression of nitric oxide production, the inflammatory burden on arterial walls, and the uric acid accumulation that compounds endothelial dysfunction in men over 60. It is not a miracle. It is a mechanism. And when you understand the mechanism, the correction becomes obvious. Take care of yourself, and I'll see you in the next one.